So this morning, the White House is publicly praising Robert Kennedy Jr. after the wild fights that he got into with senators at an important hearing yesterday. The Health and Human Services Secretary faced a bipartisan grilling over the upheavals that he has brought to the nation's premier health agency. A major focus during the hours he was testifying was the changes that Kennedy has made to vaccine policy since taking over. Listen to this.
You're evading the question.
No, I'm asking the questions here,
You're
Mr.
evading
Kennedy.
that question.
I'm asking the questions,
I
Mr.
asked you a
Kennedy.
question.
You promised that you would not take away vaccines from anyone who wanted them.
I'm not taking them away from people, Senator.
Let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
That was a statement.
I did not say that.
Joining me right now is Dr. Howard Zucker. He's the former Deputy Director for Global Health at the CDC, also the former State Health Commissioner of New York. Thanks for being here.
Thank you. Pleasure to be here.
I would like to ask you about but first and foremost, just after seeing everything, what is your big takeaway? What did you learn from what we heard yesterday?
Well, I'm shocked. This is a travesty for the nation, in my view. As we need to stay on the science. We cannot continue to do this from a political perspective, and the American public needs to make sure that science is leading the response to any questions that they have about vaccines or any other health issue.
So you, as I mentioned, you were State Health Commissioner in New York during the pandemic.
Yes.
And Kennedy's changes to COVID vaccine policy was a central focus during the hearing. His past views and what he's done since taking over. Suggesting at one point, Bill Cassidy got to it, but he did suggest, and people would be, not alone if they were confused by what his views are, because there's a lot of misinformation, but suggesting at one point that maybe more people died of the COVID vaccine than from the actual COVID, the disease. I mean, do you think, what do you do with that? What does that, it's one thing if it's Robert Kennedy, not a cabinet secretary saying this during the pandemic, and you were in the thick of it. It's another thing when he is the Health and Human Services Secretary. What is the impact of that?
Well, let's start with the facts. The facts are people died from COVID. The vaccine did not cause the deaths of individuals. So that's the first part. The second part is you bring up a critically important point, that he is in a position of authority and the public turns to a cabinet secretary. I've worked for a cabinet secretary at HHS, so I know people turn to them and they need to make sure that they lead by the science. And you mentioned about COVID, but more than just the COVID pandemic, I dealt with a measles outbreak, and we stopped that measles outbreak in New York by leading with the science and leading with the facts. And that's very important.
And we know that there was a lot of misinformation that Kennedy himself propagated during this measles outbreak that we saw in West Texas.
That's correct. That's correct.
One former top CDC official who actually resigned, I believe it was just last week after the CDC director was pushed out, kind of in protest, gave something of a fact check last night, and his take from literally just being there and just working for Robert Kennedy. And he said that Robert Kennedy Jr. lied to Congress. Let me play this for you.
We were just stunned at the number of mistruths that we heard. We were sitting listening to this going, we can't believe the state of our country, that the head of the health agency for the United States is actually standing before Congress, just continually making things up. He did not tell the truth.
And the fact of the matter is, one of Kennedy's central themes throughout, and since he's taken over, is public health is the one that's lying to you, and I am here to fix it. What do state and local health departments and health officials, because that was a lot of what the questioning was from senators, is this is what I'm hearing from home. What do they do with this?
So this is a huge challenge for the states and the local officials, because they turn to CDC for money. They turn to CDC for support. And when you hear information coming out of the government at that level, sort of saying that CDC is not doing the correct thing, that is dangerous. In fact, I know the 3 individuals or 4 individuals who left the CDC. They're stellar physicians and scientists out there. But in addition to that, Kevin Griffiths was the communication director at CDC. He left, he wrote an op-ed about this, and I had him on my Docology podcast recently about this issue, and he said that Kennedy had actually asked the people at CDC to look for data to support Kennedy's position on this. You cannot do this. You
that's literally the opposite of what's following the science.
Exactly. That's not how we lead. That's not how we move things forward, and that does not help the states. It does not help the states address pandemics or just outbreaks, regular outbreaks. You mentioned West Texas. I mentioned New York, but there are others. Look what's happening in Florida, potentially.
Yeah, look, and you mentioned you need to take politics out of it. There's a whole lot of politics. I mean, he's on Capitol Hill, but there's a whole lot of politics wrapped up in all of it. Democrats are calling on him to be fired. Republicans, by and large, in the Senate, they're not giving their full endorsement of him now, as they had before when he was going through confirmation. I want to play for you. Yes, this is a man who has always bbeen in politics, but Rahm Emanuel's take last night on CNN. Listen to this.
This is like that movie, the scene in Casablanca. Who knew there was gambling? You knew this guy was a skeptic. You knew he wasn't up to the job. They voted for him because they wanted immunization from Donald Trump. So if there was a secret vote, Robert Kennedy never would have been confirmed. Hands down, everybody knows it.
And we've heard from President Trump defending him, saying he likes that he has different views. He likes that he is different. A range of views is a good thing, but when it's happening at HHS, does this fall anywhere on the spectrum of a range of views?
Well, my view is it's always good to have different opinions, but that's different. You have to base it on what the facts are, and that's not.
What do you think comes of this?
I don't know. I'll mention one thing. Rahm Emanuel mentioned one movie. I'll mention another movie, which is Alice in Wonderland. That's how I feel we're like in a tea party,
really?
where we don't know what's right, what's up, what's down anymore. What do I think is going to happen? I think the American public is going to start to question and doubt what they're hearing. And what I don't want to see happen is that they turn to looking at these agencies, whether it's CDC, NIH, and FDA, and start to question the science in those agencies. These are unbelievable institutions, and the American public, the world has turned to them and looked for what they say. And I know, having worked in these institutions, that they are the experts, and we cannot allow that to disappear. And to the Secretary, I say, please turn to the experts that you have in these agencies and don't have them start leaving and quitting simply because they cannot work in an environment that is not leading by the science.
He is showing no signs that he is stopping, slowing, or changing course, and and there's no reason to do it when the president has just given his re-endorsement again last night. So, buckle up.
I hope the states also take some lead on this, and I hope the American public pushes back on it.
Doctor, thanks. Good to see you.
Thank you very much.
I really appreciate it.